Hey, Dave with Align Therapy here. We're going to talk about how to identify scoliosis in someone like Addie here, who is gracious to help us out with this demonstration. We're going to go over the Adams forward bend test, but Addie has a little bit of a difference in the Adams forward bend test that I'll show you. And I'm going to use a scoliometer to show how we pick up the rotation in the Adams forward bend test. So Addie, go ahead and turn around here. If you want to come a little closer, touch your toes. So with the scoliometer in this forward bend test, we're putting this on her back and we're coming down the spine, keeping the spinous process right in the middle. And we see a little bit of a rotation, a 3-degree rotation here, all the way down to the sacrum. So come back up, Addie. If you look at Addie just standing, you notice that her waistline is a little bit different on one side versus the other. So which way does your pelvis want to go, Addie? Do you remember? Yes. Her pelvis wants to go this way. Something that's interesting with Addie is she is wearing a lift in her shoe because she has a leg length discrepancy as well. So which leg is your lift in, Addie? Perfect. So her pelvis without that lift would be tilted this way, so the right side would be up, and that would create more scoliosis going on the left side of her low back. So her pelvis shifts more when she doesn't have that heel lift in. And so that heel lift is probably taking some of the rotation, so we're not seeing as much of the rotation in her lumbar spine. But go ahead and bend forward one more time. So normally with this curve to the left, we would see this side higher than this side. But here we're actually seeing that the right side is just a touch higher by 2 or 3 degrees, which is a little bit different than what we would normally see with a left lumbar curve. Come on back up. But when she stands, you can see that difference in her waistline, so that tells you something's going on. Addie has a fairly mild curve that is not, it's not huge, so we're not going to see a lot of rotation, but I thought it was interesting, someone with a heel lift and how that affects what's happening at the spine. So hopefully that was helpful, gives you an idea on what to look for, and we'll see you next time.